The PROFID EHRA trial is maybe one of the most important trials of my career, because it's just going to study something that's so established now. One is it'll tell us how to treat patients who've had myocardial infarction and heart attack. So we'll know whether a defibrillator is beneficial. And it's a specific patient who's had a heart attack and a weak heart. But the larger message is more of a scientific issue, where we as doctors need to be like scientists, and we need to always question the things that we're doing. We believe, because of trials done 20 years ago, that the defibrillator was beneficial. But what's happened is, over 20 years, our medical therapy has improved. So if you're a heart failure patient in 2025, you're much less likely to die of sudden cardiac death than a heart failure patient was 20 years ago. Well, if the incidence of that is declining because of better medical therapy and other things, then the defibrillator is less apt to benefit. And it's so bold and courageous of the PROFID investigators to restudy this, taking trial results and applying it to patients. We call it evidence translation. I think it's the most important job of a doctor. And what it really requires is a doctor to know the evidence, know the strength of the evidence, mix that with a person's judgment, experience, and then align it with what the patient cares about. Because some patients want everything done and they want to be aggressive, and other patients are minimizers. It's a new hobby, really. I'm a full-time doctor, and I used to ride my bike and race my bike as an amateur bike racer, but I'm too old for that now. And so I've replaced a lot of the bike racing time that I used to do with just learning about evidence and doing the podcast. I love social media because it allows for views that are outside what I call like the gated institution. So there's views that you read about in the medical journals, there's views that you hear about at medical meetings, but social media allows people to have opinions that are not necessarily vetted by the professors. And I think that's really important. It gives a person with a clever view a chance to be heard, even if this person is not a professor. The other reason why I think doctors should be on social media is because it's an incredible learning opportunity. I see studies that I would have never seen because someone posted it. I think that these large language models, these AI, it's pretty shocking what they can do. And I wonder whether how that's going to influence healthcare. It makes me more interested in coming to meetings in person to meet and talk with people, because the ability to write, create PowerPoint, do all of these things. I mean, AI is going to make that very, very easy. But AI will never be able to replace in-person conversation or meeting with people. And so gatherings like this, I think, are more important now than they were in years past.